Good morning, good afternoon, or good evening, depending on where you are in the world. So welcome to a very informal discussion on today's pandemic response. What can we learn from more successful leaders in today's pandemic, and how should we rebuild the world? My name is Matt Brady. I'm head of content EMEA Healthcare at Informa Markets in Dubai. It's my absolute privilege to be joined by two leaders who will share with us their unique perspective on the global pandemic response, and importantly, where we go from here in terms of building the post-pandemic world. So our panelists today are Helen Clark, patron of the Helen Clark Foundation and former Prime Minister of New Zealand, and Dr Maliha Hashmi, who is Executive Director, Head Health and Wellbeing and Biotech at NEOM in Saudi Arabia, as well as Deputy Chair for the COVID Task Force Leadership Team, again at NEOM. Welcome both, and thank you very much for your time.
Thank you.
Helen, let's start with you with the first question. So according to recent media reports and studies, female-led nations have done exceptionally well in the pandemic response worldwide. And I'm thinking in particular of nations like Germany, Finland, Sweden, Denmark, Norway, and Taiwan as well. Why do you think this is?
Well, let's start by saying that on average, the women leaders seem to have handled it pretty well. Not every woman leader has handled it well, just like not every male leader has handled it badly. But there is a style of leadership that's associated with women, which you've also used by men. It can be quite successful. And that is first and foremost to be empathetic, to be a good communicator, to be a listener, to take advice, to use good judgment. And I think we've seen with the women prime ministers in Scandinavia, 4 of the 5 Scandinavian countries, with Angela Merkel, with Jacinda Ardern in New Zealand, and with the president of Taiwan, people who've had all those attributes. So they've put the health and security and well-being of their people first. They didn't kind of cave into the constituency that said it's all about the economy and you can't lock down. Because the more you know about a disease like this and a pandemic like this, the more you realize that if you have a bungled public health response, the economic damage is longer and deeper. And I think these women got that, but also knew that nothing is more important to each of us than our health and well-being. If that is threatened, it's an existential threat. And that's what COVID-19 represented.
Thank you. And just to add to this, and it's an important omission on my part, but of course New Zealand as well has done exceptionally well under Jacinda Ardern, the current Prime Minister. Would you be able to comment on that particular response?
Yes, I mean, the New Zealand response is a classic public health response, and it's been very well led by the Prime Minister. Back in the beginning of February, New Zealand did close its border to China, and then to Iran. And then in early March, it took another critical step, and that was to throw out the pandemic plan it had, which was geared to seasonal flu, and to say we're dealing with something completely different and we need a bespoke plan. By the middle of the month, the Prime Minister was announcing that we would move to an alert system and that we would go to a level 4 alert, which was a lockdown of everything except essential and basic services. And it was also announced that as of X date, which was in around the mid-late March, that no one but New Zealand citizens and permanent residents would be able to enter the country. So there was a complete lockdown. Now, we had 7 weeks of quite strong lockdowns, and then community transmission went on a little beyond that, but eventually we had 102 days of being COVID-free. Then we had another breakout from the border, because this is so transmissible that if you touch a lift button or a rubbish bin that someone infected has touched, you can get it. So we've just beaten that back as well, but this time without the whole country going into a severe lockdown, and even in Auckland, the main affected region, there not being the most severe lockdown. So we've learned a lot about social distancing, about mask wearing, about rapid contact tracing and testing. And I see New Zealand likely to continue to innovate with Bluetooth technology and just do whatever it can to keep life as normal as it can be here, recognizing that the world is struggling with this.
Thank you. That's very interesting. Dr. Maliha, what is your perspective on all this? What can we learn from these pandemic responses that prove so successful? So, I mean, Helen mentioned, for instance, the effectiveness of empathy. Is this something that you can elaborate more on?
So Helen touched upon exactly the points I was thinking about. You know, some of the elements that you see in female leadership that you do also find in male leadership as well, but it's more of a quality that usually is associated with females is collaboration, kindness, cooperation, empathy, and active listening. And what Helen mentioned right now is exactly those qualities or those specific traits of female leadership, which sometimes are considered a weakness for some, but a strength for others, or that much more proven to be an act of serious strength and actually help those countries to a different level. I myself am the deputy chair for the COVID leadership task force at NEOM. And one of the first immediate steps when this COVID hit was that everyone did go into remote working, and we were doing the precautionary measures, but I also requested to have emotional support, mental support services available to all the employees. And that, you know, everyone really appreciated that. And it's just the elements of how do you break the silos of what is a great leadership? Is it really empathy, or is it do you look at your, how do you run your country? And the elements of empathy has played a serious role in just really, really paving the path of safety and health and well-being for everyone. And I think that this response that we see in the female leaders that Helen talks about has actually strengthened the reasoning of why female leadership is actually sometimes, if not many times, if a huge factor in success, and how that could actually be used as a tool for collaboration and cooperation moving forward.
Thank you, Dr. Maliha. So that's an interesting point about harnessing collaboration and cooperation to move ahead. Helen, next question for you. We're still in the middle of a pandemic, obviously, but at some stage we'll pull out of a current crisis and we'll find ourselves in, I suspect, a whole new world. What should this new world look like? How should we rebuild the post-pandemic world from your perspective? And I guess it's a very broad question, but looking at, for instance, society and the economy, it's almost like we're presented with a blank canvas, and a lot of people are talking about a reset of sorts. Of course, we've heard it all before, but this is another golden opportunity.
I wish it was a blank canvas, because then we could really draw on it. There is a lot of discussion about the big reset. The World Economic Forum, for example, is very much devoting its work now to how you could reset to more inclusive, resilient, and sustainable societies and economies. And I totally support that. I guess my concern is that countries have been so damaged economically by this crisis. They've had to dig so deep into their pockets to fund where they can social protection, job protection, business protection. Certainly my own country has, and many countries with deep pockets, that there may well be a rush back to business as usual, which wouldn't be the right response. Because I think many people are aware that really the way in which we have traditionally developed and continue to develop it is very unfriendly in many ways to society and to the environment. If we keep abusing the climate, we're going to reap more of the adverse consequences of that. We're wrecking the biodiversity. If as is generally thought, this virus has come from an animal to human transmission through wildlife trade, illicit, that of course again speaks to the way in which we have predated on species and really engaged in quite unethical behavior towards wildlife. And then you see the things that have been exposed about societies by COVID. For example, the inequalities. If you're me, you're at home, you have a secure income, you've got Wi-Fi, you can talk to your father on the phone anytime you like, your children, you've your nieces and nephews and great nieces and nephews can carry on with their education through remote learning and the iPad and the computer. Hey, life went on through the lockdown. But, 80% of the world's children were out of school. And most of those children didn't have any access to ongoing schooling at all. So we're seeing huge inequalities within countries and at the global level as the social impacts of this fight. We've also seen that our health systems didn't really have business continuity plans. So when we locked down and the focus was on COVID, there were other essential services for children's vaccination, the HIV drug distribution, the cancer check follow-ups, the access to family planning and safe sexual and reproductive health services for women that didn't operate. There's a lot of bad consequences from this. So in the big reset, we need to be thinking about the environment and sustainability. We need to be thinking about social inclusion. We need to think about how we keep basic systems and services going in education, health, and social protection, come what may. It needs a big reset, but will the rush back to business as usual allow that to happen?
Thank you. It's a very valid point and very thought-provoking, I'd say. It seems a very complex challenge ahead of us. Any one of those opportunities, for instance, preserving the environment is a huge complexity in itself. Dr. Maliha, Helen mentioned healthcare, which of course is your focus area.
Right.
From your perspective, what would the ideal post-pandemic healthcare system look like?
So Helen started off with saying we don't have a blank canvas. And one of the opportunities I do have in creating a system from scratch at NEOM. And one of the learnings from this pandemic is how we need to invest in healthy people and break the silos. I talk about silos, not just social silos, but in healthcare. And just beyond NEOM as well, I was working with Helen, as you know, Helen's the co-chair for the Council on Health and Healthcare at the World Economic Forum, and I'm one of the council members. And our findings and learnings, both at NEOM and through this council, is that we need to blend, primary care with public health, with, preventative care. And we need to have a system where we're investing in healthy people. We start early with that. And a system where, we have technology that's used specifically, not just for treatment, but for proactive prevention. And investing in a way where we're able to invest in primary preventative measures as well as public health. And it's a system where you will have a completely integrated system where mental health, primary healthcare services, you'll have, just generally secondary, tertiary care, all in a one end-to-end system where it's integrated. So you start from the beginning, you don't start from the point where you get sick. And that's a system I hope to see more in the future. The public health response that we saw from COVID accentuated and further validated the point of how important it is to have a very strong public health network in place in countries. And that needs to have the same types of importance that you see in the rest of the healthcare system. And we call it a health caring system, where you start from the cradle all the way to the grave, where you're healthy by design. You have nudging devices where you nudge people from the beginning to be healthy. And with COVID, you see that will be that much more important, even with technology where you have it at home, smart homes that remind you to be careful. We're going to have many more pandemics to come. So how can we have a response in place that we're agile and able to be adaptive to the next response? And that's where we start from the beginning. We start investing in healthy people, and we start in public health. We start investing in from the beginning, and not when it's too late or when it's only for treatment. So that's sort of the main learning that I experienced, specifically further validating what I was talking about in my strategy, but it became valid when this whole pandemic happened.
Thank you for that. And are there any specific healthcare systems currently that provide you with inspiration? So as you embark on this project to redesign healthcare in Saudi Arabia, as you look around the world, are there any specific examples of more effective healthcare systems?
So I think there are many high-performing healthcare systems. And what really I've been doing with my team, what we've been doing is looking at all the systems and taking out the best approaches in each of them and sort of consolidating together to the strategy that we're developing in NEOM. And so I wouldn't say there's any one specific inspiring system. I think there are many, and each has their own specific asset that we can take and learning that we can bring into our own system. And that's the best part about having the opportunity to create something from scratch, is that you can look at different systems in Spain, you can look at the systems in, you know, other countries, you know, the Nordics, and you can learn from them and bring them into your own strategy and into your own building, and then create something that has all the elements from all these high performing systems, and you put them into an end-to-end system together.
All right, thank you for that. Helen, another question for you. So based on your previous response on the post-pandemic future, how do we get there? So if we talk about reducing inequalities around the world, if we talk about placing greater emphasis on the environment, which as we see is suffering with all the fires around the world and rising temperatures, all these are very complex challenges, but it begins today, right now. But how do we embark on all these necessary changes? Because it seems to me as if they are almost impossible to resolve.
Well, no one nation can resolve them on their own, but it's one of these many challenges, and we face a syndemic of challenges, right? We have lots of things coming at us at the one time: the climate crisis, the biodiversity crisis, the other planetary boundary crises as we emerge what the planet can tolerate from the way we live as human beings, the protracted conflicts, the ongoing extreme poverty, which is rising at the moment due to COVID, along with world hunger, and then the pandemic overloaded on top of it. So I think for many people, I think, what on earth do we do? It's too much, and it is. So I think you need to look at the global level, the national level, the subnational level, and what the community, the family, the individual can do. And we can certainly all do things. I do think that the Sustainable Development Goals and Agenda 2030 that was agreed at the UN in 2015 is still a very good framework. If countries are prepared to look holistically at these issues across the spectrum of sustainable development, which is not just about environment, it's social, it's economic, and try to chart a path where you do no harm to environment from the way you push your human development and your economies, and you try to build these inclusive and resilient societies. Now, a number of countries are making very serious efforts at that. You look at the efforts of, for example, Germany, which has been producing social sustainable development strategies since the 2002 UN World Summit on Sustainable Development in Johannesburg. I mean, it has